Hi, everyone, and thanks for joining us today. I'm Nathan at Pneuma Thrive, and I uncover the deeper purpose within so that you experience the vital energy needed to create the unique life that you prefer. And today I'm here with Mike once again and Nurse Linda. Welcome.
Thank you.
Thank you.
Nurse Linda, if you would be open to share how you got started into medicine and how you met Mike and what kind of inspiring and meaningful things you've learned along the way and experienced.
I was a registered nurse for 33 years. My family background, my grandfather was a country doctor, horse and buggy doctor, serving the people of Washington State. My mother followed him and became a registered nurse also. It was just a part of me that just kind of evolved because I was noticing some family traits and wondering about my history at 16 years old. And so I kind of got into health, and that's kind of where I went from there, was discovering new health pathways that would be in the 60s. From there, I went to nursing school and I made prevention my goal kind of in nursing. I went into labor and delivery so I could help with families have a good, healthy start. My goal in nursing was preventing and teaching people. And I moved to Port Townsend area here on the Olympic Peninsula because we wanted to be where the air was good and the water. I met Liz at the co-op. She was sampling products and I was just like, wow, okay, you guys are local. I came for a visit and we just kind of became friends. We have the same ideals and wants for people with prevention and health for people and to live a happy life just like you do.
Yeah, when you say prevention, what was something that you became aware of? Was that in nursing school? And how would you say you define that motivated you?
The prevention started when I was 16, when I was noticing family traits. Both of my sisters lost their hair, alopecia, and I was like, what's going on here? And so I tried to figure that out for our family, and I just watched my diet, basically. So that was my first preventative. I actually started drinking spring water, going out to the springs and collecting water. So I just kind of followed that path. When I tried other things, besides nursing, I always came back. My heart says go there. And so that's when I went to nursing school.
When you met Liz and then Mike, how did that start? Did you get to use the products first?
Met Liz locally and I tried their product and it was something I was looking for. And so I came to meet Mike because at that time I was also working with a nurse practitioner and volunteering for her. It just seemed like it would be a good fit all around for all of us. And so that's how our friendship started, was down the path of there's got to be something more out there.
What was the product that you first tried, or when you say that was what I was looking for, what are you referring to specifically?
I was looking for a detox deodorant, something that wasn't going to harm me.
Mm-hmm. Were you already aware of deodorants out there?
Through chemical sensitivities, being a nurse, I was involved, around chemicals all my nursing life.
When I first met Linda, she was very inquisitive. She wanted to know, before she buys things, she wants to know more about it. She is involved in making her own formulas. When she came in with a nurse practitioner, we had the Oligoscan, and the nurse practitioner started sending her patients to us so we could measure them on the Oligoscan. Linda wanted to be more of a part of what we were doing, hands-on. She's been really interested in how the formulas, working with the preservative, the application, and then she has her own family and friends and neighbors who have gone the medical route, weren't getting any better. We always have these meetings, what to do, what type of formula, how to work with their lymphatics, because these people have just given up everything to take medications and not understanding why they're not getting better.
When did you first learn about the scan, Linda?
From coming here and visiting, and of course I had an Oligoscan done to see what it was all about. I just wanted to learn about that and how the different areas overlap on the Oligoscan and how you have got to coordinate things with the Oligoscan.
Something was restricted in her body. I said, you have a restriction. And it was actually a dental problem. It was affecting other parts of her body.
Mercury fillings?
Yes.
All this stuff goes
down.
She was describing some things. And so we kept working on this. She worked really hard on it. It doesn't happen overnight. It took 1 or 2 years before we got it kind of resolved.
Yeah. It's a steady process.
Yes, steady process.
What was your experience, Linda, when you saw where all the levels for the metals were in your first scan and the minerals and vitamins? Was it overwhelming, or were you very like excited and motivated? Like how do we balance all this out? How do we start the cleansing process?
Right. So I was just very interested to see how the minerals and vitamins work together. And even if your body's not open, there's certain blockages where you can't even get through, and the Oligoscan actually points them out so that you know where you're starting.
What would be an example of that you noticed?
Well, I like zinc. I've noticed that. And then, of course, I love dark chocolate. So, of course, my lead and cadmium goes up when I do too much of that. So it's just kind of a way of being able to recognize how your body is doing. And you have the knowledge of it with the Oligoscan because it's how your body is doing right now. And so that's the beauty of it. It's not like hair where it was 3 months down the road, or it's happening now. And how can I fix this?
So you knew about labs and blood work and urine and hair. And so what was the thinking you had of seeing how fast Oligoscan was?
The accuracy is right there. And then you have the different areas of the Oligoscan that overlap for your knowledge so that you can clarify why this is blocked and why that is blocked.
Or why something's not showing up in blood.
Yeah.
She can tell the dentist what's going on because we know the mercury levels that something had to be done.
Yep.
Did you do blood work after the Oligoscan to cross-correlate anything, or seeing the scan results, you're like, this is enough for me to not need another hair tissue mineral analysis, blood, urine, etc.?
I did just have some blood work done, so I was going to get an Oligoscan to compare. That way we would have actual knowledge. And for that reason, as a nurse, I like how easy it is, accessible. There's no fear. It's just your hand, your non-dominant hand. And it's light. It's nothing puncturing your body, nothing invasive. It's really a benign, just kind of like a thermography.
It's a timeline because you have a baseline,
point, right?
And then you go from there. And if something happens, a change in the body, the chemistry or whatever, you have an accident, it's picking up these things. And so she knows now how to self-manage and be proactive in that area. It's a new way of looking things where people just take for granted they can go every day and just leave it up to the doctors. Now she can intervene. She uses a product all the time.
Every day.
Yeah. So because
sometimes twice a day.
Yeah. So we know how
to manage it
because as we get older, we don't sweat as much. We're not as active as we were when we were younger, riding bicycles and hiking there. And so now we have to produce artificial sweat. That's the main way to get, keep the lymphatics open. You don't get sick.
No, I haven't.
Yeah.
No.
Yeah, we both don't get sick because we keep our lymphatics open.
My husband had heart surgery due to his family history, and it was a sudden thing. So we went over to Seattle UW, and I took Mike's respiratory freedom product, and I used it around my nares and my mouth. And I was in the hospital 24/7 for 2 weeks, and going up and down elevators, consulting with doctors, going to the cafeteria, all those exposures to people walking in, and I never got sick. I think that's, for me, it's like, that was a good test, 24/7 in a UW Seattle hospital where you have everyone from all over.
After Bruce got home, he had some things that happened afterwards because he started using the product.
Yeah, the swelling.
He had swelling, is what it was.
Yeah.
And so we were able to get his swelling down because that's one thing after surgery, nobody mentions about where these fluids go. Nurse Linda knew immediately what to do. And
I was very thankful for your product for him.
Yeah,
because it really helped move the swelling in his legs.
Was it the healing soles, or what did you use on your husband?
I used the healing soles on his feet, and he had been using it, so it wasn't like a new product for him, because I wouldn't want to start a new product on someone that was that critically ill. I would have started a lot slower. But that's why it is an individual process for everyone. So I use the healing soles and the nighttime detox on his inside of his calves and the back of his knees, and also on his hands, because they harvest veins and stuff. So we had a problem with his left arm. I used the healing soles on my husband on his hand. I was talking about the acroinial ducts there because he had that surgery where they took out his artery there for his heart. And so he has all this swelling and stuff. So by using it on his acroinial ducts on the palms of his hand, it helped with his swelling, and then the neuropathy that goes along with that too. It was just a very useful, benign product I could use, really, that wasn't going to interfere with anything they were doing.
The benefit of using that is because you have all those anesthesia, all the bacteria.
He had 2 scans in the hospital.
Yeah, so contrast agents.
Yeah.
And a lot of people don't realize when they go home, that's still being retained by the body. They were both very active, giving me reports on how that, the post-care of being out of the hospital is something nobody addresses. In fact, I think earlier I sent you a thing on drug clearance, that they only look at urine and blood. They're not really looking at lymphatics or the skin permeability. It's just not in the lexicon of the medical world right now. And this is something I think the medical world has to wake up about, is that after a mammogram, after a contrast agent, MRI, CT scan, whatever is invasive to the body, anesthesia, any type of chemical, has to come out of the body, because it's going to be circulating.
My husband's cousin, she was having back problems. So I said, hey, let's give this a try. I made it for her because her provider also told her that her kidneys were half functioning. You've had a couple of scans, you've had breast cancer, let's give this a try. And so she used it routinely on her back every day. And she went to her provider 2 months ago, and her provider said, well, what have you been doing? Your kidneys are looking better. And she said, oh, I'm using this product. And, she hadn't heard of it, this provider. So Nancy kept using it. Now her kidneys are normal. All of her blood work's showing normal for her kidneys.
And that's usually the benchmark for kidney health, is the blood work.
Yes, and your urine would also be a way, because it's how your kidneys are functioning. Those are the 2 ways to understand how the kidney's functioning.
After using Herbalix, they showed that the levels, whatever they're measuring in the blood or the urine from the kidney, was balanced.
They were normal blood tests for her kidneys. And they look at different areas, how your kidney filters, and they have a ratio. There's different blood tests within that they're looking at for enzymes, just different things. So it was all normal compared to her previous ones. So the provider could actually compare them. I found that very encouraging. I was so happy for her.
And that's how these things develop, Nathan. That's how the nighttime detox deodorant, women started to rub it all over their breasts and other parts of the body. And we got this feedback, and we said, well, we have to investigate this to expand the scope of this product. And that's how we developed a deodorant and maybe a breast cream to match it. It's an area that is untouched, the lymphatic system, and they using the topical approach. We were so excited when Linda came back and told us this, because we know we're on the right path. And here's somebody's in trouble, a family member. It's this one case that could develop for a lot of other people. So we know the kidneys have its own lymphatic system, and if it's swollen, those lymph nodes can't move those contrast agents like the way you want to. So the backflow goes into the lower back, and that's why they have that, where they have to go to the bathroom constantly. They have a lower back problem.
This is from the lymph nodes in the kidney being swollen.
It can be. You have the blood filtering back and forth with the lymphatic system. Well, the lymphatics are not moving. The blood's not filtering as best as it can be. And so that stagnant fluid expands in the lymphatic vessels. And if it's around the kidneys, it's actually causing a squeeze on that. So those extra fluids are affecting the nerve endings, and that's what's telling the brain something's going on. And so that's why the doctors do the blood, but they don't know that next to the blood is the lymphatic system that's going unnoticed.
Just like our blood pressure goes up so can our lymphatic pressure from the pressure of the blood vessels next to your lymphatics. And so that makes them less effective.
And there's no way that lymphatic pressure is measured to this day yet?
Yeah, actually they do. When they put the cuff on, when you have a cuff on your arm. For blood pressure, they're measuring both. It's intermixed. When they draw blood, they're just drawing, they're drawing a lot of extra fluid. And when they put the cuff on, they're measuring both, but they don't realize it.
Yeah, no, they only talk about your blood pressure.
Yeah.
It's a blood pressure cuff.
Yeah, but it's really blood and lymphatics.
Nurse Linda, were you able to provide a medical view of how Herbalix products were working?
For me, it was like, wow, okay, let's do women. My friends all have breast cancer. Let's figure out breast. And so I kind of, he was already on that road, but I was just like, that's where I want to go. I want to do this. Let's look at the breast stuff for Mike. And so that's kind of where I got it. My interest went was
because of the prevention mindset, and then you're noticing a pattern of cancers developing in women and wanting to like crack the code and see why is this pattern showing up or something else.
I was just very interested in how I can help my friends, basically.
Yeah. Well, I think the other part is that we made the connection on the Oligoscan that at the cancer conference in Jacksonville we attended, and they all the doctors had invited their cancer patients to be there, and these doctors, they were having these, the talks, and everybody was in there, and we were one of the exhibitors, and that's when people were coming by, and we had them fill out the questionnaire, and they said, yeah, my doctor's here. We would measure them on the Oligoscan, and I go, your zinc's low. I go, nobody's measured my zinc before. Why is that important? I had somebody for 5 years measuring the Oligoscan around here from a squim area. She was in her 60s and she was taking the tablets. And I said, zinc tablets just don't show up on the Oligoscan. They don't move the meter. She ended up with a full mastectomy. And when we measured it again, her zinc was still low because she hadn't switched to an ionic. So somehow the ionic zinc actually makes a difference in the body. As we've all heard lately, especially in the scientific world, a lot of these studies were falsified, and they brought references that had nothing to do with the study. When we do a study or we have a product, we want a clinician or another person who wants to do the study or somebody using it to have the same results. Having the same thing happen exactly as the way you developed it is the correct way on these products. An underarm deodorant, they put you in a room, 100 degrees, they put a placebo on one side, and they put the antiperspirant maybe on the other side, and they see how you smell and sweat. There's no sweat. Well, the problem with that, both underarms are different entities. So in other words, you better to measure the underarms. And that's what we did, that they kept it 3 weeks in a row. They had a placebo of nobody using anything for a week. Second week, they put an antiperspirant under both arms. And the third week, they used our product. But what they did was they did tape strippings of the underarm of the left and right. And that's when we found the discrepancy between the cascading of fluids on the non-dominant side.
I love that study.
Yeah,
it's so interesting.
And so we hear all these deodorants, and nobody knows that they're safe out there from these other companies.
Well, just the left and right-handed side.
Yeah.
No one even compares that.
What did you find most interesting about that?
Learning about the non-dominant side and how that's what we have to pay attention to.
When they palpate their breasts, usually it's the non-dominant side. On the lymph node, the lady or the female will tell me, it's my left side. And I said, you're right-handed. And they go, correct. Now,
so it does show up more on the left side.
So when they say it's my left side, meaning what?
Lymph nodes on my left side.
That hurt, or what's the context behind that?
Well, when you compress with your fingers, it's swollen the lymph node because it's got toxicity in it. It may have toxicity from the mouth, or it may have it from even the earrings.
You're at the cancer conference, you're talking to people, and you're noticing the pattern where they say that there's stiffness or hardness on the left side below the clavicle, and they are right-handed.
Correct.
Got it.
We found out a bunch of runners over here, they all wear earrings and wear runners. Now, when you wear earrings and you exercise, that creates sweat and salt. And actually, it reverses itself. Now it starts to actually increase the metal salts from the contaminants in the earring to get on the dominant side. So, it had confused us for years why people would get it on the dominant side and not. And then we started putting it together.
When you say metal salts, can either of you describe to people who are new to this what that means and What is a metal salt? How does it break down from a metal into a salt?
Dr. Howard Maybach and another couple scientists went and bought jewelry and measured what was inside them, like what are they composed of? And a lot of them were made from a lot of contaminants, beryllium. They had, silver, lead.
Just low-grade metals.
And so when people put it on, the body dissolves metals very quickly.
The salt in the skin is dissolving the metal earring part, or what part of the body is dissolving it?
It's in the earlobe. It's actually soaking into the earlobe, and it's going into the lymphatic system, the sodium channels of the skin, and then as it starts to come down, it gets into the thyroid and the nodes in the neck. And so a lot of people will have the stiffness of the neck as the first biomarker.
When you've interviewed people who got scans or different events who are wearing earrings, have they communicated neck stiffness? Have you come across that pattern?
I see it on thermography. We're now having people leave their earrings on because that's their lifestyle. And when they leave their earrings on, we can see actually the metal salts heat up and come down, because you're looking at like a mammogram, it's looking for metal salt, like metal. It's attracted to metal. But with thermography, that heats up because it's a foreign agent to the body. And we can find like a river, it will actually drop down, like on Linda, it will drop, and we can see it going into the breast tissue because metals love fat.
Nurse Linda, were you ever exposed to thermography in your career, or was that new to you? And when you saw it, were you kind of taken back, like, wow, that's showing something?
Well, we did study a lot of different areas in nursing school, and the lymphatics was just barely touched on, that it was a system that followed the blood vessels, and we didn't really taught how it really got things out, or that it was what its purpose was, I guess. And so it was just kind of an area of unknown there.
When did you first become aware of thermography?
Through Mike.
When you saw those images and everything, what did you think?
I went, wow, yeah, I can see.
Yeah.
I don't wear earrings. I could just really see. And the subsequent pictures that the provider had for us to look at, you could really see the changes. And then when that woman put on her earrings and did the exercising, it threw her back months as far as what she had gotten
rid of.
Yes. And you could see that on the thermoscan. It's just the lights are different. It's color. You can see it.
Metals, once you get them in the body, is through the lymphatic sweat glands. So your skin surface is the main exit for cadmium and other heavy metals. And so that's why sweat makes a big difference in the body. But a lot of people, they may not have a bathtub, they may not have infrared sauna. The topical products are geared to the skin with directions, because we've had to make protocols to direct everything to the acroinium ducts. So without the acroinium ducts open, it's like the nozzle of a hose. You have to have exit area. So the body's made with palms, the bottom of the feet, the armpit, and the scalp. And that's where our main daily sweat comes out. Now, when those get blocked for whatever reason, for women who have had a mastectomy or have lymph nodes removed, we topically have to use it above the skin, so any collection of metal ions can create calcification, because the cell is putting out a calcium to bind to that metal to get it out of the lymphatics. Well, if your lymphatics aren't working, it just stagnates. And that's where they call the reoccurrence of cancer. So we have to be preventative, keep the sweat going. Where I found the reference to this was in a deodorant book. This is an old deodorant book. Carl Ladden and Carl Felger. They have the acroinium in here, and it talks about everything about deodorants. But the problem is, they pretty much tell you after a period of time you're using antiperspirants, your sweat ducts are going to stop sweating. We do think there's more information that they took out, because we were very interested, because really deodorants are in that gray area They change the function of the body, so they should be considered drugs. From that, I found out that the acronyms are located in this areas. Well, when you're using thermography on the armpit and you're seeing the breast drain into that, you go, well, that matches what's in this book. And then when you find out about the feet, then you can have somebody do thermography of the feet, and then you can see that your products are opening and helping restore the acronyum sweat ducts.
Can this anatomy be found in any anatomy and physiology textbook?
No,
why is it not, because I'm starting to notice a pattern, Nurse Linda, they didn't teach you anything about lymphatics in school. And then this acronyum duct is obscurely referenced in this one book. Why is it not in medical or physiology textbooks?
And because of the anatomy, and some of these things are so fine, the sweat ducts, like the pineal gland, they found out, it's got its own lymphatic system, which they didn't know about until just recently. The other one is the glial lymphatics that are invisible lymph nodes that are connected to the blood vessels from the brain down. They just thought it was a blood vessel. They didn't look, it was wrapped like ivy around a tree, that it was doing its job. We knew about it by thermography, but we didn't know what to call it back in 2007. We have that. And now it came out later and somebody says, well, that's the way the brain drains. Now they know it drains, but they stopped at the cervical nodes. They don't know where it goes after that. We do, because we can take our product up to the forehead into this lymph node, and instead of using contrast agent, because it's swollen and we open this area up, when that disappears and the inflammation shows up in the underarm, you don't need a contrast agent. We've already proved it. But
what product specifically are people using by the forehead?
Your sinuses and your eye, there's a lymphatic system that are intertwined. And the problem is we see a lot of that thermography across here and these lymph nodes. It can't drain. And so when we start the armpit, we go up the neck, we find out there's a lot of calcification here. We come behind the jaw, healing soles. And that, because of the shungite, we come up to here first to relieve, so the eye pressure comes down and people don't have sinus issues. And so we've been very lucky to be able to find the pathway to that. Going beyond that, glaucoma may be involved in here. So we may be able to manage the prevention of that accumulation of fluids that cause something like glaucoma.
The accumulation of fluids, the salts are breaking down, lymph nodes are blocked, and then there's inflammation, which is just the Latin word for like flame. It doesn't really describe what's happening or why it's happening. So what do you think about like soft or hard cataracts as well?
I haven't gotten there, but I know...
Interesting, though.
Yeah.
So that book brought the knowledge and the awareness for the acronyum, and that helped kind of expand.
And then this is one by Dr. Myers, Nicholas Myers. Great book, because people were saying, I've got a root canal, I got this, and these can have infections, bacterial infections. Low grade that can get into the breast too. The dental issue is really another area. When you're looking at the brain, you're just not looking at the brain, you're looking at where's the trash going. Here's another book. What they found out is acute cases like in India, they had these aluminum things that they put into for the wheat and corn. They put in to kill the fungus. The dogs, I guess in America it was, where a dog got involved with it and was chewing on it. And they took it to the hospital, and they had to do an autopsy on the dog to find out what killed it. And they found out it had been into one of these pellet things they put in to kill even organic fungus of wheat and corn. So that's why we're having all these problems with the glyphosates and all this stuff. Vets are working on these animals, and these are all a bunch of different cases, different chemicals. They actually have to wear masks because of the gas coming out of these animals. And so these are almost like, happen to human. That's the other one. The other one is this one. And this is an expensive book from India. But this guy, first chapter, aluminum in plants, what it does and how it strips all the magnesium out of the plant. So it's hard to get. That's why you want to buy more organic. And because of the refineries around the world making aluminum, it's infiltrating all the waters, the seas, and everything.
Thank you for watching this video with Nurse Linda and Mike. If you're interested in any of the products that they mentioned for external cleansing, you can go to herbalix.com. That's herbalix.com. And you can go to shop at the top, and you will scroll down and you'll see the different products that are available and the ones that were mentioned specifically in these videos, including the healing souls that Nurse Linda talked about that she used on her husband's hands, forearms, and legs. It's mostly used on the bottom of the feet, and I love putting this on the bottom of my feet to keep my lymphatics open so that my feet are secreting and I'm not retaining any metal salts in my feet or body. As you go through their page, you can see there is the nighttime cleansing detox deodorant that was also mentioned in this talk with Nurse Linda and Mike. This is applied underneath the armpit while you sleep, so it helps to cleanse any toxins or metals that are built up in the axilla area or the armpit. Click the product that you're interested in. With some of the products, there are a few different sizes. You can get it in a stick, or you can get it in a glass container like this. Choose the one that you prefer. Click Add to Cart. Click View Cart. PneumaThrive 20. You will enter that in this coupon code area and apply the coupon, which will give you a percentage off of your purchase. And then click Proceed to Checkout and enter your billing and shipping information, and you will receive your Herbalix products so you can help your body start externally detoxing and cleansing, which is supportive if you are doing internal detox as well. If you're doing just internal detox without the external detox, it might not be coming out of the body. If you found this video to be useful and interesting, or you learned something new, please consider sharing it with a friend or a family member. Like and subscribe, and we'll see you in the next video. Thank you.